Is there a problem? You have been in there for 45 minutes.
Prostate cancer develops in a gland, the prostate, in the male reproductive system. It may cause difficulty in urinating, pain, erectile dysfunction, or death. Prostate cancer displays a broad range of clinical behavior, from relatively indolent to aggressive metastatic disease.
Why don't you tell me what's going on?
Increased screening discovers more men affected than ever before. Prostate cancer tends to develop in men over the age of 50. Globally, about 1.1 million men are diagnosed with prostate cancer every year. The majority are treated with radical methods such as surgery and radiation or chemotherapy. Nonetheless, the mortality rate remains at the same level. This demonstrates the need for a prognostic tool that enables healthcare professionals to differentiate their treatment for newly diagnosed patients and divide them into subcategories such as advanced radical treatment, intermediate treatment, or active surveillance. Today, the most common option for detecting prostate cancer is a blood test that measures the level of the prostate-specific antigen, PSA. But it's an imperfect biomarker, since PSA is prostate-specific and not cancer-specific. A biopsy is the only test that can confirm a diagnosis of prostate cancer. It's done by removing several small tissue samples of the prostate. The biopsy samples are examined by pathologists and ranked according to the Gleason score. A biopsy can confirm cancer, but it's highly inaccurate in distinguishing between a tumor's aggressiveness or non-aggressiveness, or in predicting the prognosis of the prostate cancer. Dr. Chandali holds doctorates in both medicine and philosophy. He works as a teaching physician and clinical oncologist specialized in prostate cancer at the Karolinska University Hospital and as a senior research scientist at the Karolinska Institute in Stockholm, Sweden. Chandali's research has led to a tool that can help distinguish between aggressive and non-aggressive tumors. It also includes a knowledge base for the estimation of overall survival with or without treatment based on similarities of collected and well-documented patient data. The Prostatype test kit is a one-step reverse transcription quantitative 4-plex PCR test intended for the assessment of the RNA expression levels of 3 genes: VGLL3, IGF-BP3, and F3. This is normalized with the expression level of gene GAPDH. Both F3 and IGF-BP3 have been reported by other studies to be associated with metastasis development in prostate and other cancers. These genes have also been shown important in the development of many non-cancer diseases that are common causes of death in prostate cancer patients. Together with well-established biomarkers, the expression signature of these genes offers a possibility to categorize patient treatment programs into subgroups such as advanced radical treatment, intermediate treatment, or active surveillance. The CPMA software is a new and unique software package intended to generate additional prognostic information. We've collected historic and well-documented samples of patients diagnosed with prostate cancer. These samples have been tested utilizing the same gene combination as in the test kit. This ongoing gathering of patient information is stored in a database that is rapidly becoming an encyclopedia of prostate cancer reference cases. Add the data of a new patient. The CPMA software is based on a similarity assessment. The new patient is compared to all available reference patients in the database, and the closest and most similar cases are then displayed. Similarity is assessed through comparison of both gene-related prostatype results and clinical parameters, such as PSA value, Gleason score, tumor stage, and age at the diagnosis. All parameters are scaled, weighted, and balanced to provide the most suitable measure of similarity. The majority of patients diagnosed with prostate cancer are subject to radical treatment that may include negative side effects. By adding the Prostatype test system to the diagnostic routine, healthcare professionals have the ability to provide a more accurate and personalized treatment program for the newly diagnosed prostate cancer patients. Predicting the prognosis of prostate cancer. The Prostatype test system from Chancel Medicals.